Hi, friends. What is heart attack? What are its symptoms and how they are managed? Well, cardiovascular diseases are leading cause of death worldwide. In fact, 31% of death are contributed for cardiovascular diseases, heart attack, stroke, and complications of their risk factors. And World Health Organization has projected that this rate will increase to 50% by year 2030. So what exactly is heart attack? Well, when person experience heart attack, myocardial infarction, as it is also said, then there is a death of heart muscles because of the obstruction in the flow of blood from coronary artery which supply heart muscles. And since left ventricle, which is left side of the heart, pumps the blood directly from the heart to the entire body, it has major need for blood supply. And when there is obstruction, that's the area which affects most. And depending on which areas of the coronary artery is affected, it manifests either as a left, uh, lateral, inferior, anterior, or posterior, just a different names, as well as there are three layers of heart muscles. And if all the three layers are damaged, then it's called Q wave heart attack, and it's more extensive. The reason being it is being shown in ECG as a Q wave deformation, and of course it causes more damage than just non-Q wave heart attack. And what are some of the ways where clinician, physician find out, determines that it's definitely heart attack? ECG is one of the way. Then the when heart attack happens, there are certain chemicals, enzymes and protein being releases, and when the blood test is done, that can indicate that there was a definite loss or death of the muscles, and that's another way to find out. And what happens when person experience this heart attack? Well, he may be suffering from shortness of breath, palpitation, or pain radiating to arm, jaw, and teeth, sweating in their palm, and depending on the severity of the blockage, he or she may exhibit one or more symptoms. So once heart attack has been established, and if the person rushes to the hospital by someone, um, they have been given thrombolytic agent, and it's more effective between 2 to 8 hours, and some study shows that even up to 12 hours, where thrombolytic agent releases the plaque in the coronary artery and blood flow is restored. And after that, once the person is stable, the patient is stable, then clinician decide, depending on the severity and how many coronary arteries are affected, whether to manage medically and with lifestyle changes, or really go to the surgical route, open the heart, and perform either CABG, coronary artery bypass graft, or doing it a little bit gentler, uh, or depending on the choice of between patient and the clinician and the outcome. So you may you may notice that the cardiac conditions which leads to heart attack is much more severe than just the physical limitation that person may be experiencing for after the heart attack, like fatigue and tiredness, and um, but it's more about psychological distress he, she, and their family are experiencing. he or she and their family experiencing stress or anxiety, rather, fear of having another heart attack, or anxiety about what may happen to my kids, my family, if I have to, if I die, basically. Fear of unknown is much more dangerous and crippling, debilitating after, and many people have experiences and reported this state of mind. And this state of mind is very disempowering, and it has huge economic complications because your productivity is lost depending on your recovery period. You're off work, you're off your business premise, and not able to give you 100%, and not leave. This is not the life you envision when growing up, did you? So that's the reason I believe when it comes to heart attack and uh, cardiovascular diseases which are triggered by lifestyle, prevention is better than cure. So what can you do? Well, last in my last video, one of my last video, I shared how Professor John Denfield of Royal Brompton, in his Royal Brompton and Harefield Hospitals lecture, he informed that plaques can start happening way earlier in our life, in 20s and 30s, for everyone, even for me. But it's our lifestyle choices that determine how fast the plaque will grow. And poor lifestyle choices, such as addiction, smoking, excessive drinking, poor eating habits, and just sedentary behavior, and importantly, stress. Um, Taking stress and effectively not able to manage different aspects of work and life can trigger the progression of plaque that block coronary artery at a faster rate than if otherwise you manage it well. So things there are two things. One, which is not in our control, that plaque will happen as a natural process of aging or growing up. But things which we have control over are three things. One, managing your stress, being positive mindset, doing a relaxation technique, meditation will keep your mind into parasympathetic mode, which is conductive for improving immunity, reducing inflammation, and then choosing positive lifestyle habits, healthy eating, moving joyfully, as well as sleeping effectively. Any areas of lifestyle is affected, which will increase the chances of your inflammation and therefore plaque formation. And thirdly, last but not the least, is connection with nature, connection with higher source of your choice, surrendering, praying, and importantly, connection with your loved ones. All these three elements, once in rhythm, then you can say yourself, or you can be empowered, thinking that you are taking control of your life's destiny. And that is my hope for you, my friends. All these three areas I really described in my book, which is published on and it's available on Amazon. Vitality: A Healthy and Happy Heart, 3 Ks for Successful Weight Loss, Type 2 Diabetes Control, and Stress Management. It's all these three areas that count, and not just diet, not just exercises. So yes, go. The link will be in the description below. So check out, get it for you, get it for your friends and family who you think would benefit. And if you like personalized assistance in improving your heart health and taking to the highest level, so that you can live at optimum health and happiness, then you may like to work with me. one to one. So I'll leave the information below. And if you like this video, like and subscribe and share with your friends and family. So until we meet next time, live well and live with vitality.